expansion, but don't have one of these two identifying SNPs.
So then they wouldn't be able to use those
Ways,
targets
right.
to say, that's not the target for therapy, that's the target to tell us to go
Correct.
that way, okay.
So we're going to talk about a lot of different therapies tonight, but if you're in the 30% that you don't have one of these two SNPs, then what Wave is developing may not be for you.
So, and how do they determine the SNPs? Through some kind of blood?
Correct.
Analysis.
Through blood analysis, because we can pull the white cells out from blood and take a look at the DNA there. But the red cells don't have DNA.
Okay,
So sometimes they need a little bit more blood than usual to collect enough white cells.
thank you.
So, but to see the CAG repeats, they do blood work, so you could actually see that.
Yes.
And then look at the same blood to see if those other things are there?
Correct.
Okay.
And that's what Wave is working on, and that's what some of the preliminary work before a lot of this is, their clinical trials are going on, is happening. To kind of validate this and take a look. Okay. There's a problem with some of the therapies I'm going to be talking about, as well as why don't we have more ASOs on the market now? If it's such a great therapy, why don't we have it? And part of it is penetration into the brain, because it's difficult. The brain likes to seal itself off from the rest of the world. It puts up a big barrier, and so it's pretty tight. And we hope that it would just be a pill that you take once in a while, right? But unfortunately, sometimes a lot of these medications, they get broken down by the stomach, so you can't go through the GI tract. So you either have to infuse it intravenously. It can be subcutaneous, either through a needle or a little pump that has a little needle. A lot of these therapies are intrathecal. So what that means is that usually in the lumbar spine, there's a reservoir of fluid that's below where the spinal cord ends. So if you think about these as bones, and here's the spinal cord ends at about the upper lumbar, L1, the first lumbar vertebrae. And so what's hanging down here are some nerve roots with some fluid. And so if you usually clean the area, numb it with lidocaine and pass a very thin needle through, and then you can infuse the medication into this reservoir of fluid at the base of your back. That circulates then through and covers the surface of the brain because there's circulation of the fluid. So that's how the ASOs that are on the market now are delivered. So the one for spinal muscular atrophy, for example, is a monthly infusion. And this is, honestly, it has to be done by a doc, but it's as routine as a blood test, as a blood draw. In some cases, we have to putting it into this reservoir at the base of the back isn't good enough, and we have to put it into the brain itself, either into the ventricles, which is the fluid-filled space in the brain, or into the brain itself. Wow. Read my mind. So that could be through a catheter or going through brain tissue into where it needs to go. So delivery is a really important aspect of getting these drugs where they need to go, and has been an issue for brain-based diseases for a long time. All right, so everyone is asking about Wave because they're coming up with a clinical trial, but this was a clinical trial, the Ionis Roche trial that just came out. So just a little background, Ionis is a company that used to be called ISIS. Thank goodness they changed their name. And they partnered with a much larger company, Roche. And this is what they call a Generation 2+ antisense drug. And this is directly from their website, which I looked to see today if it changed anything, but it says Ionis HTTRX is an antisense drug designed to reduce the production of Huntington protein, which is the genetic cause of Huntington's disease. Okay, so it interferes with the production of the protein, right? That's the theory. And hot off the press, it does that. So this was top-line data that was a press release March 1st, and this was data that was presented at the CHDI conference. And so this is what everyone's talking about, and this is what was presented, okay? So 46 people with early stage Huntington's disease were treated for 13 weeks, so we're talking about 3 months of therapy, with 4 intrathecal injections, varying doses, 10, 30, 60, 90, or 120 milligrams of the compound that we were talking about, the Ionis HTTRX, or a placebo, and this was once a month. And there were significant, meaning that it was not by chance, and dose dependent, meaning the higher the dose, the more the reduction. In mutant Huntington, so this is the expanded CAG repeat Huntington, the abnormal Huntington, not the normal Huntington, were observed in cerebral spinal fluid. So we can put fluid in, but we can also take it out and analyze it. Were observed in cerebral spinal fluid of treated patients with mutant Huntington reductions up to 60%, and a mean or an average of about 40% at the 2 highest doses, 90 and 100 milligrams. Okay, so what the statistics mean is basically it's not due to chance, or it's unlikely due to chance. Now, the rest of this is really kind of predictive, and people ask me every day, what does this mean? Does this mean that we're stopping Huntington's disease? And I think the answer is we don't know yet. I think that what we can measure is the abnormal Huntington in spinal fluid, but does that mean that we're changing the brain? And if we're changing the brain, are we changing the right parts of the brain? And are we changing it in time that we can actually change the course of the disease, or even allow regeneration of the parts of the brain that have broken down? And that's what the future trials are really there to answer. Are we changing the course of the disease by reducing this abnormal protein? I think it was also important to note that there were no serious adverse events, so nobody was put in the hospital or died or developed significant issues because of participation in this clinical trial. Any questions on this one? Yeah.
So all this clinical trial only happened outside of the US?